Hello everyone, let's today make your road trip a memorable one. Let's take a break from that unpleasant feeling of nausea or vomiting, stomach upset. That's motion sickness. It's total physiological. Some are sensitive to it, some are not sensitive to it. So listen to the video to win over that conflict of vision and balance. This syndrome is easily recognizable because of its stereotypic symptoms, which can develop at the time of passive motion or even if you're not actually moving like your VR kings. Please note, this is one of those conditions in which we doctors actually emphasize upon the preventive measure rather than the treatment part. The preventive measures will also depend upon what is the severity of your symptoms. If they are mild, then only environmental modification is more than enough. But if they are severe and reoccurring and distressing a lot, then medications have to be used. Preventive measures. Whenever you are sitting in a car, always look at a distant stationary object on the road. Reduce the head, shoulder, hip and knee movement. Use a headrest. Avoid reading or looking at a screen when you are moving. Select the seat which has the least motion, like the front seat in the car. When traveling by plane, the seat over the front edge of the wing. Train or bus, the forward-facing seats. On a ship, stand on the deck, look at the horizon. Driving the car is always better than being the passenger. Turn the air vents on your face. You can use that hard ginger candies. Have a controlled, mindful breathing. Avoid nicotine. Don't overeat. Stay hydrated and have small, frequent meals during your journey. Then you can always use the acupressure bands. They are wrist bands which can be applied on P6 points, which is 3 finger breadths away from your wrist crease on the front part of your arm. Apply the pressure using your thumb or index finger for 1 to 2 minutes on both your hands, or you can use the wristbands for the same. Coming on to the medication parts. These are very helpful, but they can induce sleep also. If you are planning for a long duration journey, then use scopolamine patches. For short duration journey, antihistaminics are enough. Scopolamine patches are available over the counter. These have to be applied behind your ear, but at least 12 hours before your journey actually begins. Or if not possible, at least 4 hours before your actual journey, or they won't be effective. These patches can be replaced every 72 hours, and if the symptoms are still persisting, then you can use a second patch also or consult your healthcare physician. But one thing you all have to remember for using these patches is the patients or the people who have glaucoma or kala motia should never use such patches. Talking about antihistaminics like diphenhydramine, meclizine, 25 mg every 8 hours have to be taken, but again, this medication has to be taken at least 60 minutes before your journey actually begins. Other than that, we have other medications also which can help you out, which are given in this table. But please remember, every drug has its own bag of side effects, which have also been enlisted in the table. One thing that you all have to note, ondansetron and metoclopramide, they don't decrease the symptoms of motion sickness. Now, for the people who can't afford to sleep, we again have a drug which have a combination of sedative and stimulant. That's chlorpheniramine with pseudoephedrine. Talking about the pregnant patients, because pregnancy in itself increases the chances of motion sickness, you can very carefully take the drugs like diphenhydramine and meclizine, which have been found to be safe during pregnancy. If in doubt, please comment below. We'll be more than happy to help you out. Talking about the treatment, I again emphasize prevention is always better than cure when talking about the motion sickness. So, kindly save this video for a great trip ahead, and for such more useful videos, subscribe the channel and turn on the notifications. Till then, let's keep inspiring each other and healing each other. Stay blessed, stay healthy. Good day.